Good morning, everyone. We're just going to give everybody a minute or two to get online, and sorry for the delay of even starting this. We had a little technical difficulty, and we will start this in about 1 minute. All right, let's go ahead and get started. So good morning, and thank you for your patience, everyone, for waiting for us to start this program. You're watching Morning Scoop. I'm Gary Grotto, the executive editor of the Arizona Capital Times, and I'll be your host for the next hour as we talk about efforts and support for a fully integrated Medicaid managed care option for Arizonans with intellectual and developmental disabilities, or as you're going to hear it here, IDD. And we couldn't have this discussion, however, without the help of our sponsors. And I want to thank our sponsor for today's discussion, Arizona for Better Medicaid, which is a multi-stakeholder group of organizations committed to building a better Medicaid system that improves access, quality, outcomes, and affordability by fully integrating managed care in Arizona. Arizona for Better Medicaid's members include healthcare leaders, providers, health plans, and others who are champions of Medicaid and Medicaid managed care. And at this time, I'd like to introduce one of our panelists, Sophie O'Keefe-Zellman, the spokesperson for Arizona for Better Medicaid and vice president of OH Strategic Communications. So she can tell us why Arizona for Better Medicaid is sponsoring this program today and what we're going to learn. Good morning, Sophie.
Good morning. Thank you so much for hosting us today. We look forward to this conversation. So like you said, Arizona for Better Medicaid, it's a multi-stakeholder group of healthcare leaders, providers, health plan, and others committed to building a better care delivery system that improves access, quality, outcomes, and affordability. And we support a managed care or fully integrated health plan option for people with intellectual or developmental disabilities, IDD. I know many on this today may be familiar with some of the acronyms, some may not. So I'll try to make sure I'm qualifying all my acronyms as we go through the day. And if we ever skip over explaining one, feel free to put something in the chat so we can make sure that we're being clear and informative as we move through the day. So some of our members include the children's clinics in Tucson, Phoenix Pediatrics, First Place, Children Rehabilitative Services at DMG. We're so happy to have Veronica with us today. United Health Group, UCP of Central Arizona, and other family members and providers in the area. And so we believe that Medicaid managed care can improve outcomes, provide a better member experience, and even lower costs for patients. And one of our goals is to be a trusted resource for policymakers, providers, and families by conducting research and studies on the quality and benefits of managed care. We also aim to be a convener. Partially, this is what we're doing today. To listen and understand the needs of individuals and families in Arizona so that we can help work towards a care delivery system that improves care and outcomes.
All right. Thank you very much, Sophie. And now I'd like to introduce the rest of the panel. First, we have Veronica Ojeda. Veronica is the District Medical Group's Physician Practice Transformation Manager, and she earned a dual bachelor's degree in healthcare administration and healthcare management at the University of Phoenix. Veronica has a strong commitment and passion for community service with more than 19 years of experience in healthcare leadership. And throughout her career, Veronica has accomplished her healthcare management with a strong record of success in hospital administration for nonprofit, public, and academic medical center hospital environments. Veronica succeeds in driving transformational change in clinical and operational areas by fostering strong partnerships and alliances with physician partners, senior leadership teams, community members, and organizations. Veronica's current role is Physician Practice Transformation Manager for District Medical Group Children's Rehabilitative Services, provides a key role in the evaluation, analysis, design, and deployment of new and existing clinical quality programs to support the success of value-based targeted investment programs, transforming clinical practice initiative, promoting interoperability programs, MIPS, and Autism Center of Excellence, and to ensure the delivery of high quality care in a safe environment, optimizing the patient experience and cost-effective healthcare services for patients. Good morning, Veronica.
Good morning.
And next we have Mike Noble. He's the Chief of Research and Managing Partner of OH Predictive Insights. That's a sister company of Arizona's largest advertising agency, OH Partners. Mike is a thought leader on public opinion, tracking, and analysis, and is known for being a trailblazer in the rapidly changing fields of predictive insights and market research. Mike found a passion for politics while working for an Arizona congressman before starting OHPI, the premier nonpartisan Arizona polling and consulting firm. Since then, Mike has become one of the top pollsters in the West, working with clients throughout Arizona, Nevada, and Utah. Mike's approach involves getting in the trenches with his clients, striving to fully understand their businesses and goals, with the result of providing accurate, unbiased, and actionable information. He's known for his presentations, public and private speaking engagements, and interviews where he interprets the meaning of the data. Providing this insight has led to interviews with the Wall Street Journal, New York Times, Politico, The Hill, The Guardian, Time Magazine, Huffington Post, LA Times, BBC World News, and other respected television and radio outlets, including the Arizona Capital Times and its sister publication, the Yellow Sheet Report. I had to get that plug in, Mike. Good morning and welcome.
I was going to say something if you did. I was like, you're forgetting the most important one.
So we've already introduced Sophie, but I wanted to give you a little of her background. Specializing in strategic messaging, community engagement, and media management, Sophie helps guide client teams through complex policy issues to accomplish their objectives. She has directed and worked on numerous public policy projects in Arizona. And Sophie is a former co-chair of the ASU Barrett Honors College Alumni Council and has volunteered with the Banner University Medical Center NICU Parents Advisory Council, Arizona Legal Women and Youth Services, and she's a member of the City of Phoenix Arts and Culture Commission, and she's a graduate of the Valley Leadership Class 40. Now, before we begin, I want to let our audience know that we have the chat open for their participation, and we ask you to please submit your questions, and we'll try to get to as many as possible. So let's start with just some basics here. Sophie already explained a little bit about Arizona for Better Medicaid and what you're trying to do and so forth. So can you? There's a lot of our audience is well versed in this area, but I want to make sure that people that aren't well versed and are just trying to learn, if they can just get a few basic things here. So can you just give us a definition or an example of intellectual development disability? And can you give us the estimated size of our IDD population in Arizona?
Yeah. So intellectual or developmental disabilities, or IDD, it's a term often used to describe situations in which intellectual disabilities and other disabilities are present. These refer to chronic and lifelong conditions that impact people's lives, and examples of an IDD include autism, behavior disorder, cerebral palsy, Down syndrome, fetal alcohol syndrome, spina bifida, and other intellectual disabilities. And the size of our IDD population in Arizona is a little over 40,000.
Okay, great. And tell us what is managed care and the current situation with managed care for the IDD population here in Arizona?
Yeah, so managed care is the way of organizing healthcare delivery for better outcomes. Health plans, sometimes called managed care organizations or MCOs, work with the state to balance resources, to improve quality of care, and connect individual with care providers. In fact, Arizona's program, Access, has always been considered the gold standard for Medicaid programs in the country. For Arizona's IDD community, physical and behavioral services already operate in a managed care delivery system through health plans, while HCBS programs, which include home health care, therapy services, adult daycare, rehabilitation, and more, are not currently integrated as a choice for individual and families. And before I go on, I just want to say HCBS, home and community-based services, these are long-term services that individuals need to maintain their baseline function level. Services like habilitation, long-term therapies, in group homes. And so what we've found in research and in talking with families and experts is that when a family is utilizing multiple care delivery systems, it can create fragmentation in care, particularly in care coordination and communication. And that's why at Arizona for Better Medicaid, we support a fully integrated health plan choice option for this population so that they can have access to a single care delivery system to provide whole person care. In terms of who uses managed care now in Arizona, all other state-supported populations are afforded a fully integrated model, including the elderly and physically disabled population, children in foster care, and the general Medicaid cohort. The IDD population is the last population to be offered a fully integrated health plan option. And our coalition would like to see that choice expanded. You know, we really want to be able to provide folks with a voice and a choice. And we believe that integrating these long-term services into the health plan as an option for members and their families can help improve quality of care and just give people more control and choice over their healthcare delivery system.
And what are they using right now? We talked yesterday about the fee for service rather than the managed care.
Yeah, so right now they receive benefits through DDD, which as in the chat does kind of act as that MCO, but currently that's the only choice for families. And so we would like to see an option expanded for families so that like they have their health plan for behavioral or physical, they could also have it for their HCBS services.
Okay, thank you. Now, Veronica, tell us about District Medical Group and how it fits into the discussion we're having today.
Sorry, took myself off mute. Yes, District Medical Group Children's Rehabilitation Services is an MC. It's the interdisciplinary clinic for medically fragile and medically complex patients. We treat pediatric patients from birth to age 21. We do have some adults as well.
Okay, and so what are some of the benefits of managed care that what are some of the benefits a managed care option would afford families and providers?
Giving them choice. Currently, they only can choose the DDD contracted places, facilities, providers, and families that are already living with restrictions have that only opportunity with DDD. But expanding choice for the developmentally disabled community and the intellectual disability community would allow them to choose a health plan within the MCOs in Arizona to pick their provider, their location of service, and just expand the choice for them. Currently, if they had the choice, they would be able to be managed by one single care coordinator that would coordinate all of their care, not just their behavioral health, and then another care coordinator for their medical or acute or rehabilitative services. It would be one care coordinator coordinating all of the care for the patients. And currently, the intellectual and developmental disabled community has not been afforded the opportunity to benefit from this fully integrated health plan option for all their services. And this is really what we want to communicate, is expanding choice to the IDD and developmentally disabled communities.
Can you talk a little bit about the variety of care that an IDD individual would need? If you can give us an example.
Sure. In-home care, the rehabilitative physical therapy, speech therapy, occupational therapy, behavioral health, any type of those rehabilitative services. But we want to be able to give these families an expanded choice to receive their acute, their medical, their specialist, as far as our cardiology and oncology, primary care, speech therapy. What we've been able to do here in 2021, when the augmentative and alternative communication department opened up to the MCOs, to the health plans, we were able to offer that service for the non-speech community. And it ranges with different diagnoses, from autism to all different types of non-speech diagnoses. And we're able to evaluate and provide the augmentative communication devices to both pediatric and adults. So that's been huge for us, and having families have the choice to have these services outside of DDD and just giving them an expanded choice of providers.
And the DDD, of course, is the Division for Developmental Disabilities, right? Okay. And I know your throat's getting a little scratchy there, but I got one more question for you real quick. Sure. Now, the way it is now, is it, are there communication breakdowns between the different providers? Like the speech therapist might be doing something that might conflict with, say, some other therapist? Is that what happens?
So an individual with DDD or IDD services being provided to them, they're managed by different specialty care coordinators depending on the service that the patient needs. So if the patient needs multiple services based on their diagnosis, then they're managed by different care coordinators. What that does is it delays the time that a patient would be able to receive their care. Having a choice with the health plans, it would be a single care coordinator managing all of the care instead of by category or by department, if you would, specialty. And so the families would also have a choice of where they can go, and not limited to who's contracted with DDD and who is not. And then just timely care, but that's what this is about, is, providing timely care that would help, excuse me,
and
that would have better outcomes for the patient. Thank you, Sophie.
I was gonna just jump in and maybe let you save your voice for a second, Veronica. I really appreciate you joining us today. I'm so sorry about your scratch. But I mean, that's one thing that we've found, and Veronica has spoken to, in terms of folks that are getting care delivered through two systems, is the difficulties of having multiple care coordinators. And we have Phoenix Pediatrics as one of our members, and one of their pediatricians has talked to us about sometimes with his medically fragile patients that have an IDD and are within these multiple systems, having problems getting a picture of their care, or understanding the whole scope of their care, which of course impacts decisions that they make. And sometimes families aren't always aware of the benefits they have within these multiple systems. And so, we think that this single point of contact in one system could really help with some of this care coordination between providers and services, and also communication with families about getting the services they need. And OGCOM has been, I think, a great example of how integration can help improve services for families in Arizona. And Veronica, I'm going to put the spotlight back on you. I don't know, take a sip of water.
Yeah, I'm good now. Thanks for the rest.
Take a little bit of rest, but I thought maybe you could talk about just how you've been able to get families these devices quicker, and with more kind of training and more taking these families off of wait lists and that type of thing, and how it's improved the system. And how important these OGCOM devices are for these families that struggle to communicate with the person in their life with an IDD, and how vital it is to be able to have that string of communication where someone can express their wants. Someone can say, I love you. It's a powerful thing, communication with someone who has these limitations sometimes. Okay, I'm going to kick it back to you, Veronica.
Sure, absolutely. I totally agree. In 2021, the augmentative and alternative communication specialty service has opened up to the health plans, and DMG CRS has had the opportunity to open up this department. We have a physical therapist, occupational therapist, and a speech therapist that is completing the evaluations. It's a 2-hour evaluation. Now, historically, patients with DDD would have to wait months, if not years, to get serviced, to have an evaluation done. Here at DMG CRS, we were able to get these patients in timely, and from evaluation to device in hand, it is a 90-day turnaround, and we are beating that goal. And that goal is has been pushed down by access. And so it's very important. It is amazing to have someone that has never been able to communicate, whether it's a low tech, a medium tech, or a high tech device, but to actually communicate. The first time I saw it, it was amazing. We had a 17-year-old boy who had not communicated, and mom was not sure if he was ever going to be able to. And within the hour of the evaluation, he was able to learn a medium tech device with the therapist and ask for water. And we had crackers, and he asked for crackers. And when you don't know what the intellectual and their speech, because they're not able to speak, and when it comes, when that makes a match, when they're able to communicate, it is magical. We are super honored to be a part of the OGCOM specialty department here at DMG CRS, and I really feel like if patients had more choices where they could receive their care, that we would be able to make a difference in patients' lives.
So this young man could have been sitting there dying for a glass of water, and he wouldn't have been able to tell anybody. He would have had to wait for somebody to ask him.
Yeah, there's pointing, and some patients are not able to point. But this department, I mean, it's amazing, because if they're not able to even function an iPad, or a scroll, there's toggles that would be able to maneuver the mouse, if you will. There's also an eye vision, and it's amazing. It's an eye gaze where the eye is actually the mouse, and where the eyes land is where it'll teach the patient on how to communicate, which is their eyes. It's an amazing technology, and a much needed service for sure. We're able to get patients in very timely. I think the last time I looked at our roster, our wait list, we had a 28 days wait list to get into the AAC evaluation. And then from evaluation recommendation to device in hand, it is less than 90 days.
That's great to hear. So, Mike, you've been sitting there. I haven't forgotten about you. And so tell us, why is a pollster, a political pollster, here talking today about, managed care?
Political pollster. I'm a man of the people, and Ari, for ourselves over at OH Predictive Insights, as a nonpartisan public opinion market research firm. Good question. Why are we engaged? Talk about it. Well, it was interesting with their approach of looking into this current healthcare system and what's kind of working, what's not, and are there possible options for other routes to go. Well, first is you can go a top-down approach, or you can do a bottom-up approach. And I think that's what Sophie and her colleagues chose to do, was to go from the bottom and see, hey, what are the people actually in the program, the providers of these IDD and other services, what do they think? What's their experience like currently working in the system? And so that's what we were kind of tasked out to do. And so with the survey we had, for methodology wise, we went and sampled or got the opinions of 325 caregivers. And these caregivers can either be professional caregivers or family members, but either way, designated caregivers, because a decent amount of time there's actually family members, usually the ones that taking that on. So anyways, but that was the group or sample size. And again, the community itself, there's only about 50,000 or so roughly of people in the state that actually qualify as that. So to put that in perspective, there's, we have several million voters in Arizona. We're talking about a much, much smaller population. So 325 is actually a really, really large sample size for a group that's roughly about 50,000 in total in size. So we had that, and then we're in the field for about in the month of May for about 3 weeks, roughly about 3 weeks. We were in there collecting the sample, so that's kind of the time frame we did it. And the survey was probably about 10 minutes in length of interview. And so when we one of the things we talk about is like, hey, first qualifying them, right? Making sure these are exactly the audience we're looking for. But once we qualified them, running them through the questions of, hey, currently, what's your experience like? What do you like? What do you not like? Hey, here's some other option, or, are you aware of this option? What do you think of it? And then, of course, giving them some extra information to see if that, makes an impact or not. And so some of the key findings, at least that we found, was that when it was all said and done, 3 in 4 caregivers in Arizonans with intellectual developmental disabilities support that managed or that Medicaid managed care as an option for delivering long-term services and supports such as home and community-based needs. And so roughly 63% of caregivers viewed the managed care option favorably, so 2/3 of our folks. So initially out of the gate, it started strong, but then after them learning a little bit more about the program, it actually increased about 13 points to 76%. So it went from 2/3 out the gate, which is a great starting point, but even after a little bit more information, it even increased to 3/4 of that audience saying that it was pretty important.
So, the people you surveyed, they started out with a pretty favorable opinion of DDD, correct?
Yes, because you'll have certain times on issues, they'll start at 20, 30, 40%. That was a pleasant surprise to see, hey, where was it out of the gate? So it started already in a good position and doing this work a lot on a ton of issues. That's definitely in the higher percentile of good places to be.
And what were some of the, facts that you told people that got them to change their opinion about managed care?
Oh, there's a couple. One is that, hey, let's say you had, because currently in the current system that's working, you work between 2 different entities right now. And I'm sure Veronica and Sophie can speak more to the nuances of that. But there's currently, you kind of work in between as a current provider. You're dealing with kind of 2 systems, but having one point of contact, we saw was a really big deal, especially with those that had higher turnover rate. Because not everyone, certain people, they'll have a provider for 2, 3, 4 years. They'll have for some time. So, and other groups have, or people have families have different experiences where they'll go through, 3, 4 providers in a year or so. And they found that especially the pain point was larger with those that had maybe a little bit more turnover. Just again, issues with, hey, am I supposed to be talking to this group or another? But having one point of contact for when you're getting your services, that absolutely resonated. with the group. And then also, I'd say, more, they said more accountability they'd like to see. So again, when things are happening or they say they're going to do stuff, making sure that they go ahead and do it. But it's, so there's just a couple of the items, but I know we got a few more questions around there.
No, and I mean, so you may have already answered this, but is that what the families and caregivers like about a managed care system?
Yeah, it was. So the biggest thing was what they love about the managed care system was that pretty much that stability and accountability, and also that simplicity of having kind of everything in one place compared to it kind of being disjointed, which it seems might be a little bit of the case right now. But right now that that was really the big thing: flexibility of opportunities, and then accountability and stability.
And what key issues do the families and caregivers face when they're accessing services? That were you able to get answers on that?
Yeah, when it came to their access of service, they definitely had I think they had issues with lack of options. Right, there's kind of really only one system now, and there's really like, oh, can I try this over here, or and so that's kind of the issue right now. So lack of choice currently, but also the other pain points currently were really just, I think the other thing is mainly just being a bit disjointed, and then again some of the accountability measures that really we touched on.
So Veronica, do the findings of the poll reflect what you see in DMG services and the experiences of the families you work with?
Yes, it does. You're able to hear me?
Yes.
Yes. The polls definitely reflect what we're finding here. So speaking to the families, often I'm up in front of the clinic where our augmentative and alternative communication department is located. And we find that families were grateful that the extensive wait time is no longer. They were able to talk to the therapist right away. Our outcome department it's set up with a speech therapist and an occupational therapist, one to determine the speech and one to determine the mobility. And many times what they're finding in DDD is that it is one specialty service and it's not a combined, coordinated visit. So you're working with two different types of specialists on the same goal. And so that type of expansion in patient choice and access to care was huge for the families.
Thank you for that, Veronica. And so I want to ask a question from the audience. Maybe you can answer it, Sophie. Doesn't Arizona already have managed care for people with IDD, with Division of Developmental Disabilities serving as the MCO?
Yeah, and I tried to wrap this in earlier, but
okay.
But right now that DDD is the only option for that. For those services. There's not multiple health care plan options for folks to get HCBS through Medicaid Managed Care like there is for behavioral and physical health. And so one of the things we're looking to do is just expand choice for families. And I think one of the reasons why the Medicaid Managed Care option was so popular in Mike's survey was because it was an option and people like to have choice. And so we don't want to, we're not interested in taking away what DDD has. And if people are happy with their service delivery, they should be able to stay there. But for others who think it might help them to have a more integrated approach to their healthcare needs, we think the expanded choice through health plans for IDD services, specifically HCBS, would be really helpful in improving their care experience.
All right, thank you, Sophie. And I'm sorry if I missed that earlier. And
oh no, you're good.
Making you repeat yourself.
I obviously didn't do a good job, so I'm glad I got a chance to take a whack at it again.
So besides the survey Mike did, you've done a series of forums to hear from IDD families and service providers. And tell us tell us about those, and tell us what you learned from them.
Yeah, so a big part of what the coalition has undertaken in the last 2 years is a concerted effort to reach out and listen to families and providers. We really want this to be, a bottom-up approach and understanding people's experiences and their needs and their wants. And so we've done listening tours, which is included 7 community forums with providers from across the state to kind of talk through how they're experiencing the system now, talking through, what a Medicaid managed care option for HCBS could look like, or what it has looked like in other states, and what they would need to see from the system to make it work for them. But we've also really worked to reach out to families, the people that are affected daily by these services. We've done 7 focus groups with families from across the state in both English and Spanish, really taking a deep dive into their experiences, what's working well for them, and a lot is working well, and what is not working well. And then talking about kind of the tenets of a managed care option and what their thoughts on it and how it would work for them. And a lot of what we learned is kind of reflected in what Mike found in his poll. People are frustrated with the fragmentation and care coordination for these families that have, medically fragile and complex care needs for their family members. Having multiple care coordination is really hard on top of their daily lives, on top of the needs of their other family members. And so having that single point of contact would be crucial. They also have pain points among turnovers with their care coordinator. We've talked to somebody just a couple weeks ago who I think had 6 care coordinators in the last 2 years. And the health plans have demonstrated that they have a much lower turnover in their support coordinator. And one person, and because of the turnover, sometimes I think that we had a family member tell us that she felt like she was caring for the care coordinator, that she was informing the care coordinator of what her services were and what her needs were and how to access them. So we really want to make sure that, we're building a system that delivers care holistically, whole person care, takes into consideration social determinants of health to work better for these families that really are experiencing a lot. We've also done several webinars with experts here in Arizona, but also from other states that have integrated HCBS services for the IDD population, just to learn more about their experiences. We've done informal surveys, and we've partnered on research studies as well. So we're really interested in learning more about what these families are going through and what they need so that they can get a better care delivery system that works for them. Because that's what's at the heart of it is, making sure that these families' lives, they're getting the care they need, and they don't have to be, their own quarter. They have a good quarterback in their corner for these services.
Now, we were talking earlier about these forums that you've had, and you said that they can be, rather emotional experiences. Can you tell the story about the lady you were telling me about that had adopted the young man?
Oh yeah. Pulling out my behind the scenes chats.
Yeah.
We have this, we met with this woman and who was in one of our focus groups. And it was just a really beautiful story of how she was a group home provider 40 years ago. And one of the persons in her care, her family passed, and she found out they had left. She had designated her as the guardian. And now it's been 45 years that she's been living with this person. I'm trying to keep folks anonymous.
Right.
with complex care needs, who's now an adult, who has kind of aged through the system. And so she just had a wealth of experience in how coordinating different services, especially as people age, can get more difficult when they're in these different systems. And it was very adorable. Her and her husband are 76 and 80 and are looking to take their honeymoon in Ireland. And so they were looking for respite options because they wanted to be able to go, but they wanted to make sure that their person was taken care of. And it was just this beautiful relationship with this, how this woman had become integrated into their family.
Thanks for sharing that, Sophie. And Veronica, this question may be for you, and this is also from the audience. I hope you'll talk about how being able to provide and train on communication devices then allows the schools to properly evaluate child's intellectual abilities and provide them with appropriate education. Can you answer that?
Sure. So at school, speech therapists are able to make an all-com evaluation and make a recommendation to have a device provided to the patient, to the student. And we found that some school therapists may not have all of the experience that's needed for an evaluation, because there's so much that needs to be covered. And really these evaluations are scheduled for 2 hours. And so if a family that's watching needs an all-com evaluation, you can have it provided to the school, or you can seek out through DDD services. But we now at DMG-CRS are providing this evaluation. I'd love to talk to you. And if anybody out in the community or anybody that's watching, an evaluation can be given at any time. If there is an advancement, or if there's a setback in the communication, another evaluation can be provided. And then every 3 years, a new device can be issued if it's not broken or stolen or any of that. So there's a lot of underlying rules that go with all-com. I'm happy to speak to anybody in the audience about this, but evaluations can be given at any time. A PCP, a primary care provider, would write the referral to have the evaluation completed, and then we go from there. We take care of all of the supporting documents. School therapists can provide an evaluation. When we do an evaluation here, once the device is arrived in patient's hand, we invite the teachers, and we invite counselors, we invite therapists, external, all of them to participate via Zoom if they're not able to be here in person, to learn how to use the device along with the student and the family. So anybody in care of this patient, of the student, we invite them via Zoom, of course with patient consent, parent consent, and we're able to teach everybody that's providing care, because the goal here is that everybody knows how to use the device so that they can help with the device with the patient and the student learning ability and communication. I hope I answered the question.
You've invited folks to reach out to you. How can they get a hold of you?
Sure. My direct line, desk line, 602-470-5572. I am also on the website, www.dmgcrs.org. And my name is Veronica Ojeda. And again, my phone number, direct line, 602-470-5572.
Thank you. And you could, put that in the chat as well.
Yeah, you know what? I'm also going to add our all-com email so that anybody who has any questions, it'll go directly to our all-com email, and it is managed by a couple other leaders and all-com department. So I could help assist as well.
Great, thank you for that. So Sophie, Arizona for Better Medicaid, you've also partnered with other groups to study managed care in other states. Is that correct?
Yeah, we partnered with HMA, Health Management Associates, which is a large national kind of healthcare research and consulting firm, to look at how integrated care has been working in other states. just so that we could learn more about the benefits that it could potentially bring to Arizona. And just currently, just for reference, a weird factoid I picked up is that right now we have 18 states and 25 programs that have integrated care for the IDD population. And what these reports shown, and there's 2 of them and they're available on our website. One is growth in managed long-term services and supports and impacts on community care. And the other is managed long-term services and supports improves quality of care. And I'll make sure to put our website and information in the chat. But what these reports found is that these integrated programs can improve quality of care, quality of life, and physical health outcomes. The survey data across the states consistently shows improvements in these cohorts when incorporated into a comprehensive integrated managed care model that includes coordination between the individual and their medical and social supports. They find improved member and provider experiences, mainly because of what we've been talking about today. It is easier to work with a single point of contact to coordinate care rather than kind of being passed back and forth between separate entities that have separate systems. They also found things because of the better care communication, fewer costly hospital stays, improved access to primary care physicians, increased registrations in these programs, and just overall improved quality of life and experience of care. And Tennessee, which I think Gary talked about earlier, is one of the more recent states to integrate HCBS into its managed care IDD population. And they've had lots of success. We also have a great webinar on our website with Tennessee providers and Tennessee health plans, kind of talking about how that system, that transition system worked for them and kind of some of those benefits. So if you just have another hour to chill, feel free to check it out. When Tennessee's TennCare, which is their Employment and Community First Choices program, integrated IDD services into their existing managed care programs, they had more individuals with IDD registered for HCBS within 20 months of the program than in the previous 6 years. So you had more people having access to care, whether through increased service delivery, increased communication. They also see 20% of working age individuals with an IDD that are enrolled in the TennCare work, which is 7% higher than the national average. So they're allowing adults with an IDD, enabling them through their supportive services to live more independent lives and, you know, to give them the supports they need to have jobs if they're able, which is a huge, you know, there's a lot of dignity in work, right? And in having as much independence as possible. And that means so much, not only to these individuals, but their families when they have those wraparound services they need to be as successful as they can be and reach their potential. In Kansas, the CanCare program was able to increase primary care physician visits for members by 80%. They decreased their costly hospital stays by 29%, and they decreased emergency department use by 7%. And then I think, you know, what we've talked about a lot today is kind of member experience and member satisfaction, because that's what's at the heart of this, is ensuring that these members and their families that are affected by these services are having the best experience they can. And the HMA report references a multi-state study that showed that folks in integrated managed care programs had 28% higher odds of responding favorably to questions related to experience of care and quality of life compared to their traditional fee-for-service beneficiaries. So there's some really great data coming out of other states. You know, this isn't an untested concept. It's working really well. And so we just want to continue to have this discussion about ways that we can potentially bring a program, an option like this to Arizona for these families and individuals.
So let's talk about next steps. What's going to happen next as far as Arizona for Medicaid improvement, and Are you going to be contacting lawmakers? Are you going to be hiring big time lobbyists and making a big push, or are you still educating folks? What's next?
Right now we're still in that education and research phase, and we really are driven by what we're hearing from folks and the research that we're conducting. And so we are going to keep talking to families. We want to keep talking to providers and also decision makers, folks at the administrative level, sharing these examples of success, sharing, polling data from these reputable polling firms in our state that demonstrate that there's a real demand for increased options, and so our goal right now is just to keep working with the community and making sure that we are convening folks in important conversations like today about, how to dream big, how we can improve the care delivery system for folks within the IDD community and their families.
And what needs to be done? I mean, do we need to change laws? What needs to be done administratively to get to what you're striving for?
It's our understanding that it can be an administrative decision. And so we want to make sure that we're talking to folks from, different government agencies, that we are educating our lawmakers, and of course, working with all the new staff members that will be coming in with the administration change, just to make sure that this is on their radar and they have all the facts available to have these really important discussions. And a couple years ago, this discussion had come to the table. And at that point, the Governor Ducey administration had asked that folks go out and talk to the families, that this making sure that this is something the families would want. And so partially that's something that we have work to do, is to talk to families, educate families, learn more about other states, and just kind of demonstrate that there is curiosity and kind of a need to increase options, that people do want to improve the system and are looking for, alternative ways and increasing their ability to have control over their healthcare.
Mike, I got a question here from the audience. Did the sample size of 325 include any adults with IDD?
I mean, adults with IDD?
Yeah.
I'd have to look. They include adults with IDD. This was back in what?
I don't believe so, just because I think it was focused on caregivers and family members.
Yeah.
But we can double check that.
Yeah, it doesn't seem like we would have that in there, but again, this was back done in March timeframe, or May timeframe actually. So, how about you? 5-6 months in this line of stuff is a lot of numbers to keep in your head.
And Mike also has a new baby, so I mean, new baby brain. It affects moms and dads alike. But we'll double check on that, and I do think that maybe is a next step that would be interesting to see if we can make sure to include that in a sample size or do a focus group. And I know someone in here had asked too about folks with adults in their lives with IDD. We have had lots of representation in our focus groups, even though I know a lot of our members tend to be focused on peds, but in our outreach, we've definitely talked with families with adults in their lives. And that obviously that's a complex conversation too, that's important to have because of care needs as people age. All
right. So we got about 3 minutes left. So that gives you each 1 minute to wrap it up. Any final thoughts from each of you?
I'll go quick first. Is that I think final thoughts is that, when we're looking at specifically at the IDD, caregivers, the current ones in that role, is that, it was clear that a couple of things. One is that, they actually didn't have like a bad opinion, by the way, currently of Arizona Department of Disability. Actually, 75% had a very somewhat favorable opinion of the organization. I think really more what it was is that experientially, there are a couple pain points that could be potentially addressed, and that also the potential option of managed care can actually provide, potentially solutions to some of these pain points that are currently happening. So I think really the big takeaway is that, with this especially very vulnerable community, a lot of people talk about a lot of other stuff, but, this group that's, roughly only about 50,000 of our entire state, yes, they're very tiny. However, they're incredibly vulnerable. But also I think the research shows, and I've seen, is that it seems very clear that I think there's a big opportunity there to improve the lives of these folks that already have a challenging life compared to many of the rest of us. So I think that was probably the most interesting thing about this project, was that, hey, this tough community, but also there's ways we can improve that. There's ways we can do better, but also that, through collaboration, education, I think we can, make some lives a little bit better, especially those that already have a tough go at it as it is.
All right. Thank you. Thank you, Michael. And Veronica?
Yes, thank you. So just, in healthcare, where our main goal is to improve patient outcomes. And so we just would like to see the improvement across the system with healthcare and allowing families and patients to have a choice.
Great. And Sophie, you get the last word. Carry us out of here.
All right. Well, again, thank you everyone for sticking with us today. And thank you, Gary, for facilitating this conversation. But yeah, I think with Veronica and Mike said, we're about giving folks a voice and a choice. We want them to have options for their healthcare that works for them, just as they do in their physical and behavioral health. And we really think an integrated option would allow folks easier care coordination and increased communication over their healthcare needs. And so we want to continue to dialogue with folks about this and how it could work, and dream big about how to improve the care delivery system so that everyone has better experience and better outcomes.
Great. Thank you, Sophie. And I'd like to thank our audience for tuning in with us today and spending an hour of your time with us. We really appreciate that. And I want to thank our sponsor, Arizona for Better Medicaid, and our panelists, Sophie O'Keefe-Zellman, Mike Noble, and Veronica Ojeda. Thank you and have a good day, everybody.
Thanks.
Bye.